Welcome to 5 award-winning minutes with Steven Seidel. We have a really interesting show for you today. We have Malcolm Bohm from CEG Health, and he's going to talk to us a little bit about community and influencer-based marketing in healthcare. Malcolm, welcome to the show.
Thanks for having me. It's great to be here.
Yeah, I'm really interested to learn a little bit more about your background because I come from a community and an influencer background myself. I started, had a couple things on YouTube back in 2010. Tell us a little bit about CEG Health and how you guys bring a unique, fresh perspective to community influencer marketing for healthcare.
Yeah, I appreciate the opportunity. So my last company, we specialized in building online communities in therapeutic categories like heart disease, gut health, and so on and so forth. We had 13 of these communities. And what we learned was the word of mouth is extremely powerful, even online. Fast forward 10 years, influencers have emerged. And what we're doing at CEG is fusing community with influencers. So using the influence that these people have over their own audiences, but also infusing that content into curated communities that are interested in and following what they're talking about. So we get a heart health influencer, join them into our heart health community, and that massively amplifies the reach and the authenticity and the credibility of messages that we want to put into these communities and these audiences on behalf of brands.
Great. I just did a TEDx talk locally. There was another gal. She was a dementia expert. So I'm sort of trying to extrapolate. If she was an expert in dementia, you would put her into a marketplace where there's a lot of healthcare givers or residencies or healthcare organizations that maybe had these patients. Is that right?
That's exactly right. In fact, caregivers was one of the communities that we built. We had 150,000 elderly caregivers taking care of Alzheimer's, Parkinson's, Lewy dementia. That's exactly the forum that you described is exactly what we're trying to solve for.
Great. And so for our listeners, let's talk in terms of core demographics or target market. Are you the middleman, the marketplace where you're bringing the experts and then you're also bringing in the communities as well? Or how does that process work?
Yeah, so we own the communities, number one, and we curate those audiences on a daily basis. And then in CEG, we manage talent from all walks of life. But at CEG Health, we're really specifically interested in servicing the life sciences companies. So pharmaceuticals, medical device, diagnostics, biotech. We're looking to help those brands connect with healthcare audiences that are relevant for their drugs and their devices.
Great. And I've done some work in aesthetic medicine. There's a lot of medical devices there. Some are cash pocket, some are Medicare. Does it matter, the way that they learn about the devices themselves or how they're paid for? Or is it just that you're looking to connect the audiences regardless, just showcasing the value of the medical device with the actual audiences?
Yeah, it varies. I mean, certainly in the aesthetics world, we have quite a few clients in that space. And that's more about awareness of the device and then ultimately trying to drive sales of those. When it comes to the life sciences companies, we're trying to make sure that patients in these communities are aware of clinical trials, for example, that we can recruit for our clients. If they have atrial fibrillation, we may want to make them aware of a certain new procedure that's using AI at their local hospital. So there's a whole variety of different programs that we enable. And again, it's using influence and community. We kind of look at it like the community is also an influencer. It's full of micro influencers that all have their own influence in their own networks. So you can look at the community as an influencer, but then also bring in influencers to that community to sort of further amplify.
Wonderful. You mentioned caregivers and a couple other areas. Do you have a recent example or a case study that you're particularly excited about, or that really performed well in this atmosphere?
Yeah, honestly, We did a campaign at the beginning of the year for a genetic testing company, and they had a really interesting solution. It was to tell you if you are at risk of a disease versus actually having the disease. So it wasn't a diagnostic. And we did a combo study and program with them and doubled sales within a week. So it was literally on-off switch. It was just amazing how impactful the community and paid media and influencer marketing came together and just blew the doors off very, very fast. That's a case study that's on our website.
Great. Well, if you want to learn more about Malcolm and CEG Health, you can check them out. There's going to be information here at dailynewsnetwork.com. Also, I'm sure you can check them out at their website. If you want to share your site, feel free, Malcolm. It's been a pleasure to talk with you today.
Thank you very much. Yeah, it's weareceghealth.com.
Weareceghealth.com. Wonderful. Well, Malcolm, it's a pleasure to work with you and to learn more about you. You guys are really changing the way that things work from a healthcare perspective. Thank you so much for sharing these wonderful tools for all of our listeners. We'll talk to you soon.